afternoon, ladies and gentlemen. Today is good afternoon, ladies and gentlemen. Today is February 9th, 20, sorry, February 8th, 2025. The year is kind of moving fast. Before we know it, we'll be at the end of the year. But today, I want to welcome you to another edition of Healthcare Watch. And we are also again looking at how we can improve our clinical laboratory system in our healthcare system in Liberia. Today we're going to be focusing on the core laboratory. The last time we discussed blood bank. Today we're going to be focusing on core laboratory, how we can make that department, or the essence of that department in laboratory science. For those who are in the clinical laboratory, will understand that. I'm going to be joined by our CEO and boss, Dr. Positive, Stephen Keller. He's going to be joining us later as we go through the program. Again, I want to say thank you for Dr. Positive because he's our big IT man in the background. I want you guys to know because this man is the one that is going to change the IT world in the Republic of Liberia. So he's in the background and doing his thing. And I want to really recognize him for that because it takes a lot of work to put our program out here for you to see worldwide. But you can also follow us on Facebook, on YouTube, on our LSR channel, and on my personal channel on YouTube as well, Emmanuel Sapolucia on YouTube. You can follow us on there. Again, we want to say welcome to LSR Liberia Shall Rise. And for Liberia to rise, we have to discuss healthcare. So welcome. But before we go into detail, let us welcome Maran Kase as you introduce our program to you when it comes to how Liberia shall rise.
Sweet land of liberty, we prophesy to you, you will rise, you will shine, you will prosper in Africa. Yeah, the word. Liberia, sweet land of liberty, we prophesy to you, you will rise, you will shine, you will prosper in Africa. Yeah, the word.
Thank you, Maran Kase, for that beautiful song, Liberia Shall Rise. We know you, Liberia, will rise and will become that nation again on the hill, the shiny city on the hill in Liberia. Will be that lone star again that will shine all over Africa and yay, the world. So as we go through this, ladies and gentlemen, again, I want to say welcome and welcome to our dynamic, loyal, humble audience, number one audience of Liberia Shall Rise, Mr. Riverses Pro. Mr. Riverses Pro, I want to say thank you for joining us and welcome to the program. And I hope, again, today you will contribute as you do normally. So please, hat off to you from the family of LSR. And as we go through this, please bear with us as we go through this. This, again, is a teaching exercise to educate us on how we can build a laboratory system, a standardized laboratory system in Liberia. And we are going to be touching those things bit by bit to see how we can advance ourselves. Again, I'm Emmanuel Sapolucia, your host, your humble host, and we'll be joined by our CEO and boss, Dr. Positive, or AKA Stephen Keller. So let us jump right into it. Let us jump into this thing. So again, we're going to be discussing core laboratory. In the laboratory, we have different parts. The last time we discussed blood bank, okay? And we talk about how blood bank is needed for transfusion, where we're using blood from the human body as a treatment or as medication, right, to help humans survive. So today we're going to be emphasizing, or we're going to be focusing, we're going to dive into core laboratory. Now, when you hear the word core laboratory, it means it's the main backbone of the laboratory, right? It's the biggest department in clinical laboratory science. It's the biggest overall. And the importance of that department is to give a quick turnaround time when it comes to providing diagnosis or treatment, right? So in that department, we got different branches or different little benches in that department where we do things at a rapid speed. Now, in the laboratory, you will hear STAT, ASAP, and routine, right? So STAT normally is within 1 hour that result should be put out. And this is where it happens in the core laboratory, okay? In the core laboratory, you got a little bit of everybody. You got blood bank, we'll talk about it last time in detail, which is a specialized area. We got microbiology, which is a specialized area. We got immunology or serology, which is a specialized area. Okay, and all those, the turnaround time, the stat labs from those variants, we put it in the core lab, right? And chemistry, urinalysis, and all those stuff, hematology, they all make up core lab. So as we speak about core, I mean, as we look at our different slides today, I want us to pay attention to some of those things that the laboratory does. I mean, laboratory does as a whole when it comes to impacting patient care in healthcare. All right. So this is kind of the scope of our core lab. So the core lab have hematology, as I said. They have the clinical chemistry. We got immunology or serology. Then we have urinalysis. Normally in most labs, and not all labs, in most labs, urinalysis section is normally referred to as a stat lab, right? And some laboratory will use that particular department to run urine, some little bit of micro, depending on the laboratory, and everybody has a different way to set up the laboratory. But stat lab normally will be the entire core lab, right? Which we're going to be discussing today. In there, you have hematology, you got chemistry, you got immunology. But each of these departments, however, they are specialized area by themselves in laboratory science. For example, hematology, I could be a hematologist, okay? And somebody could be a chemist. Somebody could be a serologist. So those are different part of the lab that we can specialize in. But generally, for me, Emmanuel, I'm a generalist, so I can work in any department. And I know I have worked in almost every department. The only places in the laboratory that I have not worked will be histology and cytology. Those are the only places that I have not worked. But immunology, serology, blood bank, micro, chemistry, hematology, urinalysis, all those areas, I have extensive control over those areas. I can work them efficiently and effectively. Okay, and that's the advantage of being a generalist in the laboratory, because when you specialize in a certain area, it's difficult to kind of leave and go to other areas and venture in anything. So for me as a generalist, I can work in any department and can work better than any other person who will work for like the guy who is in blood bank. When I used to work in blood bank, I had a guy who was specialized in blood bank. They just worked there throughout their life. They cannot venture in hematology. They cannot venture in chemistry. So that's the advantage that I have when it comes to being a generalist nationwide. Okay, so I have my national certification, which is the ASCP. Okay, and that gave me the American Society of Clinical Pathologists. That gave me that ability to be able to work in every department, because I have taken the exam for that and passed it. Now, if you're a hematologist, you want to focus on hematology and take that certification, and that's what you specialize in. So you can't venture with chemistry. However, I've taken the exam in all these areas: hematology, chemistry, immunology, micro, blood bank, all urinalysis. I've taken the exam in that area, and that's the certification that I have for ASCP. Okay. So as we look at these benches, I will kind of give you an overview of what they do. Okay, and just an overview, because we have also we can do a whole program of just hematology alone, and we may not cover everything. Okay, so in hematology, what we normally do in hematology is actually study the blood. Okay, your whole blood. That is your red blood cell. Okay, so when you go to the lab, normally they'll tell you, "Oh, I'm here to draw your CBC." Okay, or CBC/DIP. That is CBC with differential. Okay, CBC means complete blood count. So we're counting your blood. Now, the instrument will analyze it, or we can do it manually. I can do a manual differential count where I would put your blood on the slide and put it under the microscope, and I will count about 10 fields. Okay, based on how many white blood cells I see in the field, or platelets I see in the field, or the red blood cell, depending on the person's condition I see in those fields, I will multiply and depending on what magnification I'm using, I'll multiply by the magnification to determine what how the quantity of white blood cell, whether it's neutrophil, monocyte, lymphocytes, and all those stuff, whether that what, and then it will also kind of tell me, hey, if they got a lot of neutrophil, this kind of infection is going on, right? If you got lymphocyte, this is what's going on. If you have monocyte, if you got high monocyte, that means you got some other condition going. Eosinophil kind of tell you what kind of allergy reaction is going, and those kind of stuff, right? So the increasing white blood cell count tell me what condition, kind of give me a hint of what condition the patient is suffering from, right? And that's what we do in hematology. So normally it will be the purple for those who have been to the hospitals or in the lab. The purple type 2 most of the time is what most laboratory use to draw your hematology, your blood banking specimen, right? And so that's what hematology does. And hematology also study coagulation, which is not too far from from hematology, because coagulation is just telling you how fast your blood clot, right? Normally those tube will be a blue type tube, and that's what we normally draw all your coagulation specimen in, and it kind of determines your clotting factors, high, and it'll be prothrombin, activated partial or thromboplastin time. It tells you how fast the patient is clotting, or your INR. For those who suffer from diabetes, we normally use, those who suffer from clotting factor, who when they're bleeding, the blood is hard to stop, we would kind of determine, we use that PT-INR to determine how fast this person is clotting, right? And it will give you numbers. We're not going to go into details today, but just to give you the overview of what we do. And then the erythrocytes, erythrocyte or ESR, we'll call it. So the ESR, this is on up that stuff. But the ESR is where we put, and most of it are done manually. So we kind of put your specimen, and now you have even gotten better. I remember when I started in the laboratory science, when I started doing the laboratory, when I started working in laboratory, when we're doing our ESR, we'll do the manual study, and it will take us an hour to read. But they have created devices that can do it within 15 minutes, and I think they even finding ones that can do it less than 15 minutes. But what it does is it tells you how long it takes for your red blood cell to settle, right? For your red blood cells to settle. The best way I can put it is if you put a bottle of a cup of water, and you drop certain things, you drop or stuff in there. Let's say you drop a coin, and you drop a round coin or a nail. How fast the nail can take to reach to the bottom of the glass, or how far a coin would take to reach to the bottom of the glass, depending on how long the container is, you will notice that the nail will go faster as compared to the coin. Because if you throw a coin, the coin is going to be going in a manner. Okay, so that's how our red blood cells, and that's what the red blood is setting for. So a person with sickle cell, especially for our the African descent tend to suffer from sickle cell. So we use the sediment rate, the ESR, the erythrocyte sediment rate, to determine how fast that person blood will sink to the bottom, right? And that tells us, hey, this person got sickle cell, or they got a normal red blood cell. Normal red blood cell will be a concave, like a donut shape, right? They have a concave look like. When the time comes, if we do hematology in full detail, I will explain that to show you the different cells that you have in your body, which maybe we'll do in our next segment. But let's see what we're going to do. We can discuss hematology, and then we'll know what it does, right? But that's what the hematology does. Hematology will just study your blood to determine whether the person have low blood cell. Like, for example, when you hear they say, oh, especially women, okay, when they start telling women your iron is low, when they start telling me your iron is low, we are looking at your hemoglobin level. Okay, normally your hemoglobin level tell us how much iron you have. Or if they tell somebody, look, your bleeding is hard to control, then we are focusing on your platelet. Okay, or if the person has some infection, where UTI, for example, we look at your white blood cell count. Okay, like even allergy, we look at your eosinophil count, your eosinophil level. So that's just for white blood, for your CBC and stuff like that. So I don't want to go into detail, but if we do hematology, then I will give you all those cells and their significance, how important they are to you as an individual. Okay. Now, in the chemistry department, The chemistry department in core laboratory is even bigger, right? Because we study a lot of things in chemistry. So the chemistry department it studies your enzymes, it studies your electrolytes, your glucose level, it studies your cholesterol level, and the whole your drug level. So the chemistry department is the biggest department in the core laboratory, right? Because it studies a whole range of different elements or different things that we have in our body, right? It will study your electrolyte, and your electrolyte make up your sodium, your potassium, your chloride, and your bicarbonate. And we who did chemistry back home, you heard about all the elements. Some of who had to draw the periodic table, right? Almost all of your natural elements on your periodic table, you can find in your body. Almost all of them. I'm not saying everyone, but most of them can be found in your body. So your sodium, we did sodium, we did chloride, we did helium, and all the different things. Most of those things, those natural elements, they are in your body. So they are there, but in different form. Okay, and they are useful for your body. So your electrolyte will be those things that have to do with those elements there: potassium, or chloride, and or bicarbonate, or whatever you want to call it, or sodium, or salt, somebody will call it. Okay, and then we do study your kidney function. Okay, we study your liver, like I said, and then your the hormone level, and all those things. We study them as well in chemistry. Okay, so chemistry bench, like I said, is big. We study your tumor markers. Now, if you come in the lab and the person having some heart attack, okay, we order troponin to see what this person is. Again, it's something we'll go into when we do chemistry by itself. Chemistry, like I said, is big, so we can't sit here and discuss only 1 hour. But chemistry is big, and we can study the chemistry bench as well. Now, chemistry can also be divided, right? Chemistry can be divided because we got our vitamins, right? Who should be on our immunology analyzer, okay? So those things, when we start studying, it will show all the different types of functions. Your renal. So we're talking about renal function. So there are your BUN, your creatinine, and then we're studying your kidney function, right? To see how much your kidney is filtrating. Now, condition like prostate, condition like diabetes, it will tell us based on your filtration rate, your filtration rate, your GFR in your kidney, it will tell us, hey, this person is voiding a lot of urine. Let's check what's happening. What else is happening, right? Because 800 to 1600 volume of urine in 24 hours tell us something different. And anything above that tell us, hey, this person is suffering from something. But that is something we can go into when we start to do these benches in detail. Okay. So yeah, so on your renal, we'll be looking at your BUN, your creatinine, and then we'll try to evaluate your filtration level based on what your kidney is putting out. And then we'll also know from your renal function is where we'll also determine whether you got kidney failure, right? Based on what we see in your urine. If we start seeing a lot of protein in your urine, then we know there's a problem with your kidney as well, right? So these are all things that we do in chemistry. Again, like I said, chemistry is huge, so we can't do that in one day, right? And then drugs. We also monitor drugs in chemistry, and depending on the laboratory, they can also take drugs by itself and study it different, right? And then we also study your endocrine level in chemistry, your endocrine and hormone. So when we start to measure that, I think most of us have heard about TSH. That's the most common one we talk about. All right, thyroid stimulating hormone. So once you start to study your thyroid stimulating hormone, or your T3, your T4, your FT, this and whatever, I don't want to get into that, but then we understand that, hey, this person has this condition. You study your insulin level, your cortisol level, your reproductive hormones, all those things, the testosterone, your estrogen, and all those hormones. Then we can understand that, hey, this person got this condition, and it is from this that we also determine the level of for the women to see whether this person can still have kids. You know, when we study certain estrogen level and hormone and other hormone level, then we can determine after 45 and so forth. Because when the DC start to decline in women, that's when doctors tend to tell you, oh, at this time in your life, the chances of you having child is almost not there. It's based on your reproductive hormones from what we have done in chemistry, right? When we look at those things. correct? And your diabetes is also one of those things, the endocrine and hormonal studies. Okay. And again, it's a lot. It's a lot that we can learn from in just doing a chemistry study. Now, we come to microbiology. Microbiology is a specialized entity as well. I mean, it's normally not part of the core lab or the stat lab because some of those things take weeks, let's say days, weeks to months. Some of the studies that are done in microbiology. So, like the parasitology on a micro, if you fall on a macro, your bacteriology, if you fall on a micro, those things take longer time. However, we got other part of micro that we can put on a core lab. Okay, we all know 2020 introduced, or late 2019 to early 2020 introduced something in the world, not just in the United States, but all over the world. That we all today, every year now, we have to take some kind of vaccine. The COVID, okay, that part is under microbiology, but because it needs immediate intervention medically, it can be brought under the stat lab. And what are some of those things? Like your flu, okay, flu, RSV, and now we are hearing about RSV that is not getting prevalence in the United States, right? So RSV is killing people now in the United States. I know we had, I think, if I'm not mistaken, in Texas we had up to, I think, 5 cases last month. So, but in other states, I think it was Louisiana or so, that they have about 10 cases. So RSV is becoming prevalent. So that is something we studied. Those fall under micro, but we can bring them on a core lab because we want to rapid respond, we want to give rapid result right away so that that patient can start antibiotic right away or whatever treatment that is necessary for it. Now, I must indicate, and I'm not speaking as a doctor, I'm speaking from the laboratory science aspect. I don't diagnose, I don't diagnose based on my license. Okay, I do the studies and present that to the doctor, and the doctor is the one that can pronounce the diagnosis. But what I can do, and in the lab, I may not be able to tell a patient, hey, you got this condition, but I will already know. But I will let the doctor who is licensed to make that pronouncement because he or she is the one interacting with the patient. That's why we, as laboratory scientists, we don't give diagnosis. Even though we do in the background, we can only let the doctor know what the diagnosis is, and he can give that pronouncement to his patient to how to call it. Okay, so let's see if we can address. I can see the bottom of this. Mr. Pro, he said, how do they use just one container of blood draw from a patient to give result on cholesterol, diabetes, and different condition? How are the separation done? What are the possibilities of? Oh, that's a very good question. And thank you. Oh man, I love that question. That question is awesome. So Riverside Pro. So yes, it is possible. For example, in chemistry, okay, and I just named some of those tests that fall under chemistry. So in chemistry, I can draw one tube, like the yellow tube. Okay, that tube can be used to for diabetes, for fasting glucose, but it has to meet certain criteria. For example, if I want to use one tube for cholesterol level, for diabetes level, because that will be testing for glucose, for other conditions, it must meet all the criteria that fall within that. For example, glucose and lipid are normally fasting testing that we must do. So the patient must fast 8 to 12 hours, but must drink a lot of water. So if you went to the hospital, and that's one of the mistakes, sometimes people who are giving instruction to the patients, they don't do. They tell the patient, hey, you need to fast for 8 to 12 hours. But they don't tell them that you need to be drinking while you're doing that, okay? So you need to hydrate. You need to drink enough water during that time so that when you come to the lab, your vein will have enough fluid in it because the fluid helps the blood to do. But at the same time, do not drink water that will dilute your specimen. Now, to answer your question, when that specimen comes to the lab, even though it's one tube, we have different reagents that can test that patient's specimen. Okay, we don't need a lot to test your specimen. So, for example, if you bring your yellow tab, your gold tab, or SST, we call it serum separator tube. When we bring that specimen to the lab, or that specimen to the lab, we spin it down. The serum from that, we can divide it using different reagent that have the antigen to match whatever that specimen it has in it to identify whether the person got high level of glucose, high level of cholesterol, whether we're doing CMP to determine your ASD, your ALT, all the different tests. Like if we do chemistry in detail, I can explain what we're talking about. But yeah, so we have reagents that are assigned for each of those. Using that one tube, we can divide it among all those things, and we can test for your diabetes, we can test for your lipid, we can test for your liver condition, we can test for all those things. However, we cannot use a gold top tube to test for hematology, to do your blood count. That is why if you have a CBC count and a chemistry count, for example, a lipid count, they will tell you need 2 tubes. Okay, but HIV can also come from yellow top tube. A lot of tests can come from 1 tube. Okay, but most of the time, because of volume, that's why they will ask, because of volume, because I don't know how hydrated you are. Because if you are dehydrated, the level or the quantity of serum I will get may not be sufficient. So to be on the safe side, instead of you coming, I draw your blood and then spin it down and get very little serum because you are not well hydrated, I would prefer drawing 2-3 tubes to be on the safe side, because I don't want to come and say, oh, your specimen is short. Then I call you back from your house and say, hey, John, I have to stick you again and all that stuff, because it will make the patient angry, and we don't want to make our patient angry, right? Because they are our customers. So for customer satisfaction, we'd rather stick you one time, get multiple tubes, and then we use those tubes to do your testing. But yes, it is possible that we have 1 tube with sufficient serum and we can run those tests that I just talked about. Okay, but we'll have to separate them based on the kind of tests we're running. So yes, to answer your question, that is how it happens. We use different reagents that will be used to run all the different tests that are on that 1 tube, and it won't interfere with anything. There will be no crossover. All right. So thank you for that question. That was a very good question. Yes, sir, Dr. Patsy, when I see you, I know there's a question. You are muted, sir.
Yeah, Professor, thank you so much for this education. With you mentioning all these different specialties, I know you just went to immunology and serology, right? But let's go back to microbiology. Let me ask my question on that. So from my perspective, what I'm seeing here is everybody got an area in the laboratory department. But the question is, when you are going for the training in the US or wherever you got your education, do they kind of teach you everything, or you have to specialize in one of these fields for you to become a laboratory technician?
So normally you do the general, you do all. Okay. I know when I was teaching at Texas Southern University, we taught, and when I went there, actually, we did everything. However, most of the time, it is good for you to do everything. And then when you start to work on these rare benches, then you can say, oh, you know what? I want to specialize in it, but that's what you have passion for.
Okay. Yeah. So go ahead, finish. Sorry.
No, then you can specialize if you want to be microbiologist. For me, I don't want to be specialized in any, because I always want to have access to all those departments. That's why I decided to take my ASCP on the general level so that I can have access to all of them. So I'd rather do the higher study and get a certification than to do one little one and then just focus on that.
All right. Yeah. So I think based on what you are explaining, I'm better understanding this, right? Because if I look at our own path in technology, right, you have people that are information technologists, right, which is the degree I have. So as an information technologist, I'm a jack of all trades. I call myself a chameleon, right? Because you can fit in any specialty and then go deeper in that, right? Because it gave us an overview of the whole information technology field. And then when you decide to go for your master's or PhD, then you can say, all right, I'm going to specialize in this, right? So we had kids that were in computer science program, and those guys, they were our programmers, right? They did the programming, but we that were in information technology, basically we went over requirement gathering, talking to the customer, making sure the customer is happy, doing all those kind of stuff to make sure that the project is done efficiently. So from what I'm seeing here, I think the education from your perspective, what you did will be ideal for Liberia. The reason I'm asking that question is for Liberia because if you have all these different specialties, right, and people don't have those different specialties, then it become a problem. So I think even if we decide to teach laboratory science in Liberia, we should do the general course level, and then eventually people can specialize in different things as the organization or as a program get better, right? Because right now, if you just go and say we're only going to teach microbiology, you'll be doing a laboratory technician a disservice in Liberia. So I just wanted to add that. I don't know what you think about that.
No. Thank you, and that's a good point to make. Yes, and that's why I keep emphasizing, because even in the various department that we talk about, they have specialty within specialty. For example, in microbiology, is one of the best one that we can look at.
Mm-hmm.
In microbiology, we got bacteriologists, we got parasitologists, and we got people who study fungi. So those that are, even though they are working in microbiology, we got microbiology generalists as well. But then you got to go and emphasize, you can go emphasis in bacteria or fungi, parasite, or whatever you want to do. So they got specialty within specialty. The same way with blood bank. In blood bank, we do generally blood banking. However, you can also go to the antigen studies. Okay, and then within the antigen studies, some people choose one antigen, they just focus on that as well. Okay, look at genetic makeup. So we always got specialty within specialty. So, but that's a good point you made. Liberia, yes, Liberia is not suitable, and I'm not saying you can't specialize, but based on what we have in our country, it will be better you focus generally. And the generalists are held to the same standard in the laboratory science. We are held to the same standard as the guy who is specialized in blood banking. It's not that we're going to study halfway. No, we're going to study and know the antigen and all those other things. The only difference is when it comes to who to supervise or oversee that department, they will take the SSB. That's for blood bank, because the ASCP you receive in blood bank is called SSB. So then it will refer to the SSB, because then he has done more study than the generalist.
And then just to add on to what you're saying about the generalist, so in Liberia, I know you have visited some of the labs in Liberia. Usually it's either one or two man teams, right, in those departments. So you tell me, like in Liberia, if you now say we need everybody to specialize in one thing, you need a 10 or 5-man team, and we may not have that, right? And I always go back to Sapolucia and say the guy in Sapolucia, if he's a doctor, he's the laboratory technician, he's everything. So if you're asking him now to become a specialist, then you're doing a disservice to those people in Sapolucia, because they only have Dr. John Brown, and Dr. John Brown and his lab technician are the only people. They're not doing everything else, So, but I will let you continue your teaching. I'll sit in the background.
Oh, no problem. Thank you, sir. But let me answer Ross's question. Because Ross says, yeah, that's a good question he asked. Yes, the color tab matters. And this is another the people who deal with this and we teach them are normally our supporting staff in the laboratory. We call what we call the processing. The processing department, they are phlebotomists. They do get ASCP, but in phlebotomy, because their job is needed to draw blood. Okay. And phlebotomy coming from your vein and whatever. So they do it to draw blood. So every color tab, like I talked about the yellow tab, is normally no anticoagulant. That means no additive, we call it in the lab. No additive on the red tab, mostly. The yellow tab, the tiger tab, normally they do not have additive in it. Now, when it comes to other tab, like the gray tab, green tab, blue tab, and the type of blue, we got different types of blue. We got royal blue and the other blue. So we got different additives in there. Some of those additives will be EDTA. We have sodium heparin. We got sodium citric heparin. So we got different types. We got a whole laundry list. So each color tab has different additive in it, right? Just to answer your question. So they mean different things. And those are specific for certain tests, all right? So so to answer your question, yes, the different color tabs means different things. But those colors that are named, the SST, the tiger tab don't have additive. It has serum separator like a gel in it. The yellow tab has the gel in it. And then the red tab normally is just plain tube. And that can be used for most tests that we run in the lab. To answer your question. And thank you for that question, River says. All right. So somebody talking about Dr. Parsley today. So Dr. Parsley, so this is Jackie Mike. She said it's
No,
always not a positive example name for me.
yeah, the Sekpakon is my main city because I don't want to I don't want to cause trouble for anybody. So I got my own city called Sekpakon. One day that town will come to reality. I'll be watching, you know. Yeah,
Yes.
but
Yes.
yeah, but continue the lecture, brother.
So yeah, so immunology, as they stated, immune, they got that immunology come from that word, the study of your immune system. So this is where we study the different kind of disorder, right? And some of those viruses and bacteria that do affect your immune system. Okay. In Liberia, what I have seen is one of the common one among the promiscuous people, you will call them. But for most of our men, it's a syphilis, right? It has a very simple cure, but people don't treat it until it gets worse, and that is ampicillin or the psyllin family. Okay, those antibiotics are very
The
good for that. That's
penicillin,
one of the the ampicillin or the
penicillin,
penicillin. Normally it's
amoxicillin.
penicillin. Yeah, normally this first start is penicillin, and if it doesn't work, then you go to some of the other psyllin family, right? So those are the family that can easily, especially when it's in the early stage, you treat it, it normally goes away with no further action. And then our HIV viruses, now we don't have actual cure for it, but we got some treatment that can kind of lower it, right? So immunologists started looking at your hepatitis, which is your liver. Okay, one of the things our people are not paying attention to, especially for those who like to bend their elbow. Why it is true, sometimes you don't think you harming yourself, but I want us to know that it can lead to destroying our liver, right? And that will do LFT in chemistry. But we got different things that we can bring into our lives, right? So, and then we got the exposure to hepatitis. For we who work in the healthcare field, we are always given hepatitis injection just to prevent, just in case when we do get exposed to it, we are kind of control, or it will not become worse as it will affect other people who are not exposed to it. So we build some immunity against it. Okay, the allergy. So serology normally will do allergy reaction, viral and bacteriology tests. So these are things that we do study in the core lab under this. Okay, there are other extensive tests that we do, but those things that we do some Western blot on HIV and other stuff, those things will take longer time. But for the core lab, these tests will run, the HIV test will run it right away and determine, hey, is he or she HIV positive or negative, right? Or if they got some exposure to allergy, we test it right away in immunology to say, oh, does he have this reaction to this, or what is he having this reaction to? All right, but immunology and serology, we can also study that in the future in more detail to understand it. But these are some of the conditions that you'll find that we do studies on in serology or immunology. And
finish. I got a question.
Yeah. So now, blood bank. I know we call it blood bank, but the actual name, the scientific or laboratory name, is immunohematology. Okay. Immunohematology. That's the actual name for blood banking. Right. The reason we call it blood bank because most of the activity that go on is we taking blood and we're keeping the blood for those that are coming. That's why it's called blood bank. But the actual name, that's just a common name, but the actual name is immunohematology. So the word, you combining hematology and immunology because you're studying the immune system and you're bringing the blood or to replace the blood or whatever you're doing there. So you're doing both studies combined together to form blood banking. So these are a combination of hematology and immunology that create blood bank. Just to put that out there, but that's something we can talk on later. Yes, sir. What's your question?
Mr. Sapolucia, I just have a question, right? When
Yes,
you collect the sample, the first question is how long does a sample take? I know you have went over it in one other show, but I have a follow-up question for that. Say if you have a whole village is being impacted by something, do you start from I would just go over the story of Mr. Weeks, one guy called Weeks in Liberia. He does these videos where he go to different villages and interview people. There was a family there that were getting blind. So my question is, with that kind of thing happening, where do you start from with your analysis? Do you start from the human body, or do you go to start testing water samples? In your lab, do you guys test water samples, or it's only just on the human aspect that you guys are testing? if you wanted to do a test like that for that community?
So we do study, and this is the department that will be responsible for that.
Okay.
So microbiology work hand in hand with environmental health. Right. So if, for example, if there is something that is being caused by we don't have to go that far, but look at the COVID-19. The reason sometimes they say, oh, COVID-19 is going to be on the rise, or it's on the rise, is because here environmental health go and take a sample of the water and they plate it and send it to microbiology. And if they see these viruses, then they know, oh, this is the cause, this is what this is going to. Then that's how we kind of find out what's going to happen, right? Epidemiology, I always kind of don't know, but epidemiology, they also studied that too as well. Okay, so they work, all those people work hand in hand, but the person who will do the testing for them is the micro. So the micro will test the water sample. I know in one of my previous, most of the lab that I have working, we do receive water sample from the different department. Okay. Yeah, from the various department in the hospital, from your tap water in your house and all that. So we take them for those and plant it in micro to determine whether anything is growing, whether the bacteria is growing in your fossil or whatever. So we do test those. So we do start from the river and stuff. Now, when it comes to blindness, there are so many other factors can be the cause, that it may be either from exposure to the sun, it could be certain food we're eating. So there are so many things. But yes, anything that is affecting the human directly, when it comes to the immune system, will start from your blood, your urine, and stuff like that to go ahead.
One last question following that, though. Since Liberia, based on your analysis, right, you never saw that our departments, our lab department had the capability, like 100%, to do the work that needs to be done. If you were planning to go and do such an analysis on a village that is being impacted like that, where people are getting blind, a whole family is getting blind, nobody knows where that is coming from, they're getting the same symptoms and everything, is there something like a mobile lab that you can take to a village like that, sample the water, take people urine analysis, do the immunologist test? Sorry, I'm not a scientist, so I'll mess up your words, but yeah, where you do these tests to make sure that people are not being impacted by the water, by the air they are breathing or something. Where will you start from? Is there a mobile lab that you can take somewhere like that?
So, to answer your question, blindness will be a high stretch for the laboratory to just start determining, because blindness is not something is happening on the eye, right? But yeah, let's take for example the typhoid or Lassa fever. Okay, those are things that you can easily detect in water. So yes, there are, and this is almost like you can have a mobile lab that you can do that, because you can immediately go to the water, dip the water, and test the water to see where you find these viruses in it, right? Because and they got this rapid test, like in one of the slides you saw PCR, right? So and that's what we use. In fact, right now it is PCR that we're using, PCR devices that we're using for COVID-19. Okay, so if you do your test, it will tell you, it will give you the qualitative test, qualitative result, present or not present. Okay, so at least we got an idea of what's going on. So the qualitative result will tell me is present or is not present, and then from there we can then determine, okay, let us find the quantity, for example. And the typical way we do it, and one of the easiest one that men can look at, is the HIV. So HIV, we test HIV on the qualitative level first, or pregnancy, whatever those tests that have easy qualitative. So when we test the HIV, we say, okay, yes, it's a positive. Once it's a positive, then we say, okay, but then let's see how far is this person. Then we go for the Western blot, or we do whatever study that we can do. Like in my lab, we're using the Genius system. So we do the Genius system and give us some quantity. It tells us, okay, the person have, I remember one patient, a simple example, one patient came to the ER one time, and the patient was having flu symptoms, okay, flu symptom, and he thought he had flu. So we wanted to test his HIV. Normally we test all the different things. So we tested HIV. I was testing it that night. So when I tested HIV, I saw that it was HIV positive. Okay. Then I had to go and do another test, a reflex test. And it was a genius. When I used it, for him at the time, it was good. Well, not good because you were exposed to HIV, but his level was very low. It was about 15, 50, level of 15, which is very, very, most of the time we see 2,000, 3,000, but his was very early. So you're building antigen level 9 that was just starting. So right away, you could start treatment, and he could get, he could not be able to pass it on to anybody, right? So that is how we do these studies. Now, the water testing we do here for COVID and other stuff, yes, mobile testing can do that, and we can always, again, develop a system. We can always, and we got one person in Liberia that is, hopefully, if he used right, he can do better. The guy who is now the current director for NPHIL, okay, because he's a microbiologist, okay, from the laboratory, Dr. Yang. He's a microbiologist. So he one good person that, in my opinion, based on what he has done in the past year when it comes to COVID-19 that I have followed and read about, his impact on that, I think he's the good person that can be somebody who can kind of easily detect Lassa fever, typhoid fever, those kind of things that you can use PCR for in Liberia.
Yeah, Professor. So I'm trying to be a good student here, right? So bear my questions. So you said in your original intro that usually everything that is on the periodic table, right, is in the, almost everything is in our body, right? That's what you stated. You said basically almost everything that is on the periodic table, all the elements on the periodic table is basically the same thing that make up the human body. Am I correct?
Not exactly. I said most of the natural element.
Okay, yeah. So I'm trying to repeat what you said, but
yeah.
Anyway, to ask that question though. So I'm saying I'm trying to put myself in the mind of a microbiologist, right? So the same village we're talking about, say we go there and we check the water sample, and the water sample has, let's say, for example, it has a lot of sodium in it, right? Then we check these people's body. As a human being, maybe you're supposed to have 10% of sodium in your body, but we find out that people's sodium level is 80% or 90%, right? Is that how you guys do your analysis to determine that somebody have a sickness or somebody have a particular disease or something? I just want you to walk us, the common people, through the process of determining that somebody have something, right?
Okay. So, then when it comes to the natural element in the body, most of the time, the only way it will affect you is if you consume a lot of it. When you have more than you're supposed to have in your body, right? So the natural elements normally don't impact us unless we are consuming more than we're supposed to. For example, sodium, salt, right? Salt will not impact us unless we eat more or consume more of it than we expect.
Then you get waters and all those things.
Okay. But then the lack thereof, okay,
also impact
you. Also impact you. So if we do it at the level at which we're supposed to consume it, yes. Now, sodium presence in the water in the creek may not be caused by human, because remember, these are natural elements. They could be found in the soil. They could be provided somewhere else that could be producing it. It may not be. It may not be caused by the human, feces or whatever you want to call it, right? So we can't. However, if let's say people are drinking the salt water from the beach, the seawater, because we know naturally the seawater is salted, that may have an impact on the patient, on the people. Okay. Now, things like viruses, I wouldn't say the viruses will be unless it's that prevalence, it could be found in the running water. The reason they test the water here, because the water that are here in the States are water that are being dispensed or expelled from the sewages. That's why they test those water. Okay, the water they're testing, maybe I need to correct that. The water they're testing in the United States is not the river. It's not the river that is running. No, it's the sewage, the one that is being expelled from various homes. Those are the water they're testing to see the level of COVID and stuff like that. Yeah, so that's the water they're testing. They're not testing the river and creek and stuff like that. No. the water they are testing here for COVID to tell me whether the COVID-19 is high is the sewage disposal.
Okay.
Yes. So normally you will not be testing the water in that sense, but things from the water can affect the people.
Yeah.
That is that. Yeah, things from the water can test the people. So yes, it's possible that if people are suffering from certain things, that waterborne diseases, like cholera, for example, cholera come from it comes from drinking the water, and it could come from animals' feces in the water, or animal bathing in the water, and you taking that water to drink.
Yeah, yeah.
Right? The Lassa fever or typhoid fever comes from the rats. So if the rat is peeing in our water that you're drinking, yes, then you're going to test the water to see, okay, what causing it. Okay. Yeah, so most of the water that are not running, most of the time you test it. If it is a waterborne disease, yes, that person will be getting it from that water.
And you didn't answer my follow-up question about the mobile laboratory. So if you can answer that quickly before you go to Riverside Pro question, then I would really appreciate it.
Yeah, so yes, you can do mobile lab can help, and that's why I talk about the PCR. Okay, so if you have because the PCR machines are normally smaller machines, right? They are normally handheld machines that you can put anywhere, you do your testing, but most of the time, those PCR machines are qualitative. It's telling you, is it present or not present? So it's not giving you specific. So more PCR, the COVID, it will tell you COVID is present, is not present. But until you go and do deep, then you know how level. Then they go quantitative. Because those are the two types of results that we give, qualitative or quantitative. Qualitative just tell you is present or not present. And then quantitative give you how high the level that you have, how the titer when it comes to HIV, hepatitis, or syphilis, and whatever. Okay.
Okay.
Yeah. So what Dr. Riverside Pro. I always trying to call you Dr. Pro. So Riverside Pro. Riverside Pro said, do you know?
I can answer her question as a good student. Yes, Riverside Pro, we can do cross testing, because if the person is a generalist, the person can actually test something, do the test that you want. If it's just a urinalysis test, that person can do it. If they are a generalist, I will leave the professor to answer, but go ahead.
So Dr. Riverside Pro, your question, if I'm understanding right, is if I want to do a urine test as a requirement from my job, and the urologist is not present, can the immunologist be asked to do? So now there's a difference doing urinalysis at your job. The urinalysis at your job is done in the chemistry, where we just test your blood to see whether somebody did drugs or didn't do drugs, whether drug is in the person's urine and not there. Urologists are not people who work in a laboratory. They are people who kind of study our reproductive system, like our prostate and testicle, vagina, and those kind of things. That's what they do. That's their job. And then within their profession, they got specific things that they study. So the urologist may not be the one to to do the study of that. Now, when talking about immunologist in a laboratory, he or she could identify, depending on what their studies are when it comes to drug toxicity, they could be able to identify what kind of drug you're using. However, though, drugs level study is normally done by the chemistry. We do a drug analysis in the chemistry department in the laboratory. Urologists are normal. It's a different field. It's not really part of the laboratory. There's a different field at the people who tell us what prostate level and whatever we want to be doing. You and I have when it comes to that. So, but to answer your question, now if you ask if the specimens can be used across to do different tests, depending on what the test is, yes, some specimen can be used. Like if your urine, and we don't use, and if I can say this, we don't use one test as a basis for treatment or diagnosis either. So, for example, if you come in the lab and you brought your urine to me and we tested it, and we say, okay, I think that person had UTI. That is not the only test we're going to use. We've got to do hematology as well. We've got to use some chemistry analysis to determine whether, okay, this person truly had UTI. Yes, that's a positive.
Yeah, so just so to understand Riverside Pro question, though, I think he's more asking for the person who can analyze or kind of interpret the test or can kind of even do the test, right? For example, you said a generalist can sometimes do everything, right? So if the chemist is not around, right?
Yes.
If the chemist is not around to analyze the sample, if the chemist is the person that can usually analyze the sample, if that chemist is not around, can you as a generalist do that analysis of the person urine? I think that's what I'm understanding from that question. You know.
Yeah. So if that is this question, yes, then that is why when I started, I said when we start to do our studies in the laboratory, we do the entire thing. Like for me, for example, I'm a generalist, and my ASCP covers all laboratory except histology and cytology. But any other thing in the laboratory, chemistry, microbiology, serology, blood bank, any other thing within our laboratory, I can test it because I have been tested and have done studies and got certificate in all those areas. So yes, I can do it. Now, the chemist, yeah. So yeah, I can test it and give you a result, and the doctor would, based on different data that we give him, will diagnose the patient and provide treatment. So go ahead, Dr. Positive. You're talking, you're muted.
Reverses Pro, go ahead and ask your question. Yeah, hello. Go ahead and ask your question. You are live.
Thank you very much. I hope you answered because I want to see. I think I called the wrong word. People like, oh, we used to work in the well. Usually they would send you to a concentrate. They would say to the laboratory to do your urine, drug testing. So I was just wondering if there's a situation where just people who are supposed to do the urine sample, you or how do you call it, immunologist, they said that they would this immunologist do the urine test. Before I listen to Dr. Sapolucia, all along I have thought this one laboratory, all you guys in just doing the same thing. Like, go to PP test, everybody there for PP test. But thanks to this discussion, I'm learning a lot. I know that there 20% can be in a lab there. Everybody got their function. I thought everybody there, they are just the same. So thank you very much. Again, you are doing a wonderful job. It's a great job. I'm learning a lot. So that was just my question. Thank you very much, guys.
All right. Take care, brother. Thank you.
All right.
Sapolucia, it's all yours.
Yeah, but I didn't get what you're breaking from my end. So again, I didn't get the
all right. So if I will rephrase what he was saying, I think I did say it right. He said staff shortage. Sometimes when he was working in the warehouse and they do these random drug tests, and he thought basically if there's a shortage of staff, can someone else take over? That's what he was asking, and I think you kind of answered that a little bit. Where if you have a generalist, the generalist can be the one to do the sample test and stuff like that. But yeah. And then he's also said, thank you for the great job you are doing. He's learning a lot. Like me, I'm kind of thinking about maybe specializing in one of these things, but it will be in my next life sometime soon. But
it can be in this life. Welcome aboard.
Yeah, no, I ain't got time to learn all the terminology right now.
That's why I'm going to show you the way around. So yeah, welcome aboard. But yeah, thank you. I mean, it's my humble. It's humbling to do this because I think we need it, and it's a privilege. In fact, let me put it that way. It's a privilege for me to share with you that or Riverses Pro. I mean, I keep trying to call you doctor. Maybe you need to become a doctor, Riverses Pro. So
working on it.
Yeah, it's great that you guys, at least you guys can tune in. It's a privilege for me to serve you. So please, thank you so much for recognizing that. Okay, so this one is from it's a personal question, and that the person already put it there just to be intentional. So yes, Madam Sapolucia, my wonderful and loving wife. Yes, it is possible that anybody else can perform a drug test. Okay. However, though, we got to be specific because we in the laboratory, it is our profession and it is our license on the line. If you just get anybody to do it, if they don't understand what the implication is, they can give any kind of result, because we got to follow certain criteria to say, okay, this person is drug positive or whatever you're looking for. But yeah, it is anybody can do it without being a laboratory technician or a medical laboratory personnel. Okay, so yes.
And I'll add a supporting statement to yours, but throw it in Liberia though. This is a problem we have in Liberia. Everybody doing a test. When somebody comes to the hospital, we don't have specific people that are laboratory technicians and stuff like that. Once I test your neck, test your hand, and I can tell you that you got typhoid or malaria, I look in your eye, open your eye like they look inside. Without doing any test, I can tell you you have some disease that may even lead to the end of your life, and that's sad. So I think I know you're trying to be nice. You want me your wife, you want answer your wife question perfectly. Me, I will tell her no, man. Not everybody should be doing tests, because that's why we have specialties, right? People have to work in their area, because if you're working in your area, your diagnosis could be wrong for somebody, and that person could lose their life. And everybody kind of is being diagnosed with typhoid. Sometimes I think the new thing is septics. The new thing is blood clotting in places that they're telling them people that they are blood clot and stuff like that, but they don't have any treatment to do it. And before you know it, they start treating the person for blood clotting, and that person die and stuff like that. So people are making wrong diagnosis, and it's killing people. So I would say no to that. People have to be specialized to do these testing. Sapolucia,
Again, for the drug tests, why the street can use anybody, but when the why or how come about, that's why people get stuck, because they're not specialized in it. That's why we always prefer the actual person who did the study, who went through the study, to be the one to do those tests. But yes, if the country has a place where, or if people have a place where they do drug tests and they got a machine, yes, but they may not know the principles that follow, because we in the lab, everything we do is based on principle and methodology. So those two things are very critical for us in the laboratory, right? And then the next thing is procedure, because we use the principle and the methodology to develop the steps and process to interpret or write our document for that. So, and if I can continue just the PowerPoint, we're almost over with this PowerPoint. The equipment that we use, most of the time in the bigger laboratory, most of the time we use automated analyzers. Now in Liberia, there are means that we can use manual processes, which would be more, it will be beneficial. But the problem we have with that is the manual test, why people are running away from it or trying to leave it, is because it becomes more subjective, right? Because in our field, in the laboratory, one of the things that is a requirement is color vision, right? And in Liberia, from the time I was there, I never saw anybody testing anybody for color vision. In the laboratory, it's a requirement. You must pass the color vision, because you don't want to be diagnosing somebody and don't know what color you are seeing, right? So to avoid subjective results, that's why we use automated machines or automated analyzers. So some of the things you need: your automated analyzer, your centrifuges to spin the blood, your microscope to read specimens, and then we'll talk about PCR machines. Our PCR machines would be the one we use for COVID, we use for flu, strep, and many other tests that are out there, right? So please, and our piece, what piece? Oh, okay. So PCR, what PCR just stands for is polymerase chain reaction. Okay, that means there's a chain reaction going on to determine whether this COVID-19 is present or not present in the person's body, right? Okay, so that's what we do. So these are things we need for our lab. Okay, quality control and assurance, and this is something I've always talked about in the laboratory. Quality assurance is a big thing for us. You have to always do quality control if it is required, either daily, weekly, monthly, but you must do quality control based on what your SOP says, right? Or what studies you have done. And before we put any quality measure in place, we must do study. We have to do study to determine if we're going to do quality quality control every day, whether we're going to do it every week, we'll do it every month, every 3 months, every 6 months, or so forth. But it has to be a study done over that period of time to determine what interval we're going to use when it comes to quality control. Okay. Yes, and there where we need a specialty. Thank you, Madam Sapolucia, for saying that. And there where you need a specialty, because the specialty can tell you now the level and what type of drug it is. You can just say, okay, because it's possible that it can tell me this drug is present. Okay, but on most of the test strip that we use for these tests, it will identify the different type of drug. So let's say I'll use a test strip that will identify marijuana or I don't know most of the drugs, the illicit drugs. I don't know most of it, but fentanyl, how do you call it? That the person that get help with some of these drugs. I mean, I just hear that on the news, but if you know of it, I'm not saying
I think like I know drugs too.
I'm not saying you do drugs, but just we watch the news and then what we hear it. I'm forgetting.
The new thing out there, I don't even remember the name.
All these different drugs.
Push and all those things. Yeah. But so that's a great follow up. That's a great follow up. It says Sapolucia posted. And then in reference to that too, though, is there a possibility? I mean, when we're on the show, we're discussing ideas as well. Is there a possibility that, like the way they came up with a PCR test for COVID? Can they come up with something like that for testing drugs? In that way, anybody can do it, like Ms. Sapolucia is saying. So let's say you're looking for that particular antigen in to determine that the person have marijuana, or the person took kush, or the person took some of the other illicit drugs, right? So you create a PCR test that then kind of show that, all right, this person has some illicit drug in their body. So in that way, when the person that Mr. Reverser Pro was asking for, if that person is not available, somebody that have been trained to look at that result can say, all right, we did a person analysis. This is the result. Write it down. When this person come back, they can validate it before the results go out. In that way, you're saving up on the speed of, or even places like Liberia, you could help to do fast testing where people can be tested fast and cheaper, right? Instead of getting a whole laboratory, you can get some PCR tests created for drugs, for malaria, for all these different things like typhoid, or other things that you guys have done over and over in the US. So I think that's an area for people to think about getting into developing those solutions. Go ahead.
Yeah, so PCR is just a device. It's just one of those machines, right? Based, and the reason it's called PCR is based on the reaction.
Yeah.
Okay, the reaction that is taken, because we got some that just go based on live reaction or whatever sensitivity is using. That's what sometimes the instruments are named after. So yes, they do have machines, and that they do test specific drugs and give you the quantity in that person's system. Okay, just that they will do the alcohol level and stuff like that. It's the same thing. So like when I was following the president, Liberia, President Boga, when he took office, newly, they were doing this drug test. Okay, they were using the strip because it's an immediate. Once the person urinate, you go and dip that strip in there, and it will give you time. Some of them are time sensitive. They can tell you from 2 minutes, 3 minutes, 1 minute, whatever time that their drugs can be reactive on the camera, on the reagents they put on those strips. So those manual tests, and that's why I talk about you have to be color. Your vision has to be tested for color blindness, because most of the things are color coded. One of the easiest one that we use in the United States, and even the nurses use this, they don't even have to be laboratory scientists to use it, medical assistant use this, is the urine dipstick. So you got a urine dipstick, is color coded. You dip it in there and you take it out. If the person it got blood in the urine, it will start to give you green dot on a yellow background. Okay, if the person got a high level of, I think, leukocyte X-ray, which is the white blood cell, I think give you purple color or something like that. So you have to have that color vision to make sure that you can interpret color right? So they do have machines, just to answer your question, they do have devices already that can analyze the different type of drugs already. So we don't, and they got portable ones too that you can take to Liberia to use. but for now they're using the manual one. Okay, so if that answers your question, but just to end up with this slide, I talk about quality assurance, and one of the most important part of quality assurance in the developed world, and what makes your laboratory more, what I would call that people have confidence in your laboratory, is based on accreditations. In the United States and most developing worlds, they use accreditation as a standard for which I can say, okay, I can trust this lab, because you got outsiders that are coming in and looking at your lab to see how your practices are, right? And that is one thing we are lacking in Liberia. We need an accreditation agency that will be not government-owned, private accreditation agency, okay? Because the government-owned may be lack of fund, may not have, in my opinion, and I'm not saying they don't have integrity, they may not have integrity, they could be compromised. But if you are a government, if you are a private entity and you're doing this, you want the money, you have laws that you can abide by from the government, you will do your job right most of the time. Typical case in point, the cell phone company in Liberia, that have shown us that it's better to have private entity controlling most of these institutions than to have a government involved. Because when the government involved, people tend to find a back door. But if it's a private entity and then may have to make his money, he will make sure things are done right. That is why I always push for compliance, and America has done it, and most countries have done it. I prefer compliance agencies or accreditation agencies to be a private entity so that they can scrutinize their product. Okay, because they're spending that money, they want to return. So that's why quality assurance is very, very important. So the role of the core laboratory in patient care, and the reason we call it core laboratory or stat lab, some people call it stat lab, is because of turnaround time. Okay, in the beginning of this program, I indicated that we have 3 levels of testing that we do. We got stat, we got ASAP or ASAP, and we got routine. Okay, routine can go from anything from 4 hours to 30 days to a year, depending on the test. ASAP is normally 2 to 4 hours, 4 hours the most. Stat is 1 hour. Stat 1 hour because it starts from when you draw that lab out of the patient arm or that urine from that patient. Once you draw it out, your 1 hour start to count down. So you got 1 hour for that result to reach to the doctor, for that doctor to initiate treatment or decision on treatment or what kind of treatment you're going to give that patient. And that's what stat talk about. Okay. Now people kind of misunderstand those things when they say I want this ASAP. They think that it means right away. No, stat is immediate for the laboratory sense. Stat is immediate. ASAP is whenever you have time. And that's what ASAP means. ASAP means whenever you have time, as soon as possible. Okay, so we have to know the differences. So sometimes we receive lab we receive specimen from some of the nurses. They say, "Oh, I sent my ASAP. I told you guys to do that to ASAP. Yes. So as soon as possible, right? But for us, it's about 4 hours. Okay, stat is if you want something to be done right away, you do stat. So that's so turnaround time is very crucial. Okay, and it supports decision making because without laboratory, you're just guessing. Okay, it helps disease diagnosis monitoring. So the patient on diabetes, you got to monitor your high blood pressure, you got to monitor your cholesterol, you got to monitor HIV. In fact, almost all conditions, you got to monitor what it's doing, right? And it plays a critical role in all cases that we do in healthcare. So the laboratory, the role of core laboratory is very important. It's the backbone. It is the backbone of the laboratory, the core laboratory. Now, challenges. The challenges we feel there is nothing without a challenge. If you have a company that you're running or you're living a life and you say you can't face challenge, that is a problem, right? So we always have challenges. And in the core laboratory, like every other places, staffing is always a challenge. Workload management is always a problem because we've got less workload. Staffing, we have more workload, right? So that it becomes a problem. And then because of staffing or lack of thereof, we can have problem with sample handling, okay? And sample handling is not only based on staffing, or inadequate staffing, but it can also be the lack of training. So lack of training can contribute to contamination, can contribute to errors, clerical error. In fact, clerical error in the laboratory science is one of the most common error in healthcare, not just in the laboratory, but in healthcare as a whole. Okay. All right. So those are things we have to pay attention to. So staffing is a big issue, and then the workload. All right, we're almost done. Now, the future of laboratory, of core laboratory, what we need, especially for Liberia, we need advances in laboratory automation. So in Liberia, you really need it. Okay, and artificial intelligence is not taking over in diagnosis, and they are becoming more accurate. Now, in Liberia, I would really recommend, based on the lack of electricity and other conditions that comes, point of care testing is your best route at this time, because you can easily reach the most remote part of Liberia, right? With a point of care testing, you can reach the most innermost part of Liberia with a point of care testing, because most of the devices are handheld, can be supported by battery or the 9-volt battery or whatever portable battery you have. Those things can be supported. I mean, it can be supported by the point of care testing, because you're doing right there, get your result, and start some kind of treatment. Okay, so based on that, we need point of care testing is what I will really push for in Liberia at this time. But as time advances, then we can improve on other things that we want to do. Now, the integration with electronic health record is very important. Okay, it makes it very easy. Electronic health record, health record makes it very easy. For example, if I have a patient that was taken from Lofa County and brought to Monrovia, if we have electronic health record, I can easily put that patient results in the system. By the time he or she gets to Monrovia, their results are already there. So the doctors don't have to order new lab tests, order new this and whatever. No, because the patient results are already there. The patient record is already there. What treatment he or she had in Lofa County, right? And it's right there in front of that patient, that other doctor in real time. So the doctor is looking at what treatment this patient have taken and have not worked, and he or she can initiate new treatment. The doctor can look at the lab result of that patient in real time and initiate treatment, even if the patient did not get treatment in Lofa County. That is why electronic healthcare record is very, very important, and we need to start making use of it. In fact, they need to start building it, because I don't think it's built in Liberia right now. So they need to build it in Liberia so that it can become so that our healthcare system can become very efficient and effective as well. So that is just something we need to do to improve our healthcare system in Liberia. So to conclude, what I would say is, like everything else, it is important that we look at core lab as a means of treating critical care right there and then, right? Once we get that patient in, we do his or her lab, we can initiate treatment. And that's how important core lab is. And if I can indicate this, I think most laboratory, if you don't have blood bank, you can send your blood bank stuff out. You can send your microbiology out. You can send all that stuff out. But if you have a core lab, you can initiate treatment while you wait for the long-term diagnosis or proper diagnosis. You can start if the person the patient got HIV. It doesn't hurt to start them on a retrovirus treatment while you wait for the quantity, the level, the tidal level of that patient, right? So we need to start immediate treatment. And one thing that is lacking in Liberia is that on-the-spot treatment for laboratory. Because from what I heard, some lab that can be tested, they have to send it to South Africa, they have to send it to Ghana. And those labs can be compromised just from flight from Liberia to Ghana or to wherever you're sticking it. All right, because whether it's a frozen sample, if it's a frozen sample, taking it from Monrovia just to get to the airport, it's taking 2-3 hours if the ice don't melt. And then when you get to the airport, it takes time, 4-5 hours before you get from Ghana or Liberia to Ghana. I mean, most of the time, those specimens the integrity has already been compromised. So those are just things to think about, how we can develop the system in Liberia, so the transporting specimen all the way to Ghana and other things. I can understand if you're doing that for micro specimen, I can understand that. But for the chemistry specimen, hematology specimen, and all those stuff, it's a challenge, because let us not forget, the red blood cells are living cells. They feed on sugar, right? They feed on sugar. So, and just as you and I, when we eat, we have to defecate to get rid of waste. The same with the red blood cell. As they consume, it has to also give out waste product, right? And if those waste products are not in the proper places that it will be getting rid of from the body, it can affect your test result as well. Okay. So laboratory, yes, like this brother said, lab time It's very sensitive. Our testing is very sensitive. Okay. So yes. So that's why it is very important to read the result correctly and make sure that the patient are diagnosed with right. Yes, and thank you so much for that, Sis Jackie. Yes, it is very crucial that we make sure we are reading our test result correctly so that patients are given proper treatment. Okay. And I know there are countless of incidences. And it's not just limited to Liberia. It's also in the United States where people have been wrongly diagnosed and they die. It happens everywhere. The only thing is prevalence in Liberia because we don't have the resources, right? We don't have the resources. But yes, Paulina, thank you. I understand that's very, very true. Labs are time sensitive and we don't do it in a timely manner. Yes, we tend to get wrong diagnosis and it can lead to somebody's loved one getting hurt or even dying. But again, I want to say thank you guys so much. Unfortunately, Dr. Pastor had to leave before our meeting, but I know everything is okay with him. But he's on behalf of him. I want to say thank you guys for joining us today. And again, please share our videos so that we can give more education program. And please do not forget, you can also suggest topics that you want us to discuss. We are not limited to healthcare. Okay, some of us, why it is true, my profession is hard. I mean, it's laboratory science, but I try to research in other areas that I can give you education or guess or education knowledge on. It doesn't have to be just laboratory science. But second Saturday of every year, I mean every month, is healthcare watch, right? Where we discuss on how we can improve the healthcare system in Liberia. That is what we want to do, and we hope that one day, if Liberia is to rise, we have to develop all these systems: healthcare, the finances, the banking system, the agriculture system, the food processing area. All those things have to be developed for Liberia to rise. And I strongly believe Liberia shall rise. And that is why we have our program or our platform called Liberia shall rise. With that, I want to say thank you guys so much for your contribution. Paulina, Madam Ruth Sapolucia, River Says Pro, Jackie, and everybody else that joined us. If I don't call your name, please don't feel bad. But I want to say thank you, guys, for your contribution. Please share our video and join us and contribute as you always do. With that, I say have a blessed and wonderful. But before I go, tomorrow we're going to be discussing on Liberation Rise on Table Talk. We're going to be discussing the mass deportation that is going on now in the United States. What's your view on that? You can join us tomorrow and let us discuss. Thank you again and have a wonderful and a blessed day. God bless.